Uh, what's your name?
My name is Michelle Mitchell.
Okay.
I am a speech-language pathologist in Cameron, Missouri, and I have a Master of Arts in Speech-Language Pathology.
Okay. Tell me about your story as far as how you found us and a little bit of a background.
I started experiencing headaches and facial pain.
Could you point to me where that was?
It was on the right side,
Okay.
approximately 4 years ago.
Okay.
It started out with having stabbing pains in my jaw area, and then it spread to my cheek area, and then it just kept on spreading and getting worse. It moved up the side of my face to my eye, and I had some droopiness with my eye, and then it just kept on getting worse, to the point that it felt like the whole right side of my head was spasmed and burning all of the time.
So you can show me the turn sideways a little bit. Okay.
From up at the top of my head, clear down this side, then back behind my ear to the bottom of my neck.
Okay. All right. And then you sought some care.
Yes, initially my primary physician felt like I had trigeminal neuralgia. Cold weather, things blowing in my face really set me off in pain.
So certain things will trigger it.
Yes.
So that's what led him to think it was a trigeminal neuralgia.
Yes.
Okay.
He put me on Tegretol and prednisone,
Okay.
but I didn't really have any relief from that.
When you had those triggered pain, would that be a particular area?
It was always on my right side.
Okay.
But it kind of varied whether it was in my master area or if it was directly on like my cheekbone.
Okay. So it's always related to this area?
Yes.
Okay. All right. So that's what led him to say that it's the trigeminal neuralgia. All right. Then what, please?
He referred me to a neurologist, and that neurologist kept me on the Tegretol for a little while, and after a couple of visits, he felt like I was having pain of the trigeminal nerve, but he questioned whether it was truly trigeminal neuralgia. And he felt like it was due to a jaw joint issue, so he referred me to an oral surgeon, and that surgeon ruled out having any jaw joint concerns.
Okay.
So
he specifically looked at the jaw joint itself?
Just through an observational assessment.
Okay.
And questioning. When I went back to my neurologist, in which things kept on gradually getting worse, by that point I was starting to have stabbing pains in my right eye. It felt like it was going through my eye and through my temple, and I was very sensitive to light, to the point that my eyes were starting to blink very fast when I was in direct sunlight. And since he said the jaw issues had been ruled out, he wasn't sure what it was, so he referred me on to another neurologist. And at that point, on my initial visit, I was diagnosed with short-lasting unilateral neuralgiform headaches with conjunctival injection and tearing, and called SUNCT for short, much easier to say. And he was just absolutely confident that was it, and that some people feel that it is a form of trigeminal neuralgia. At that point, I was put on Neurontin, and I didn't really have much of a response to that. Doses were varied, and then just different types of drugs were introduced. I was on all sorts of different anti-seizure medications, antidepressant medications. I was on Lyrica, just a whole variety.
Over how long a period of time by now?
That would have been getting close to a year.
Okay.
And I just wasn't having any relief from it. I was getting sicker and sicker. And to the point when it had been about a year from when it started, my equilibrium was absolutely horrible, and I was having migraines at that point very frequently.
Okay.
And during that summertime, when the pain would get flared up, my equilibrium was so bad that it was very difficult for me to get out of bed to even walk to the restroom. There were days where I had to crawl to the bathroom that summer.
Is that about when you find us?
Well, no.
Actually later?
It wasn't.
Okay.
At that point, that neurologist told me that I just needed to accept that some people were disabled with migraines and atypical facial pain, and just to stay with him and keep trying the different drug therapies.
So when he said you had to live with this pretty much, tell me about your family life. You have, how old are you?
I am 35.
And children?
And I have a 5-year-old and a 7-year-old.
Okay.
So they were very young at the time when this started. And it was very difficult for me to care for my children. When things would get flared up, very flared up, it was to the point that my mother would have to come and get the children and keep them for like 4 days at a time, because I was unable to barely care for myself, let alone for my family.
How about work? Were you able to continue to work?
I was on a part-time basis.
Okay.
And even at that, it took absolutely everything for me to work the 3 days a week.
Okay.
At that point, I talked to the neurologist. You know, I brought back up the jaw issues, and I just really felt like there was something else happening, and I understood that there wasn't something wrong with the trigeminal nerve as far as in the brain, they were telling me, but I still felt like that something needed to be investigated there, and I was told that there were no other tests that need to be done. I asked about having an EMG done, and the response was that can be done on the face.
That cannot be done in the face?
Right.
Okay. And what led you to even ask about EMG?
Because I had studied about it in my studies in college.
Okay, your work, through your
So,
school?
yes.
Okay,
So
got it.
I knew that it could be done, I just didn't know where to get it done.
Okay.
So at that point, I started searching for specialists dealing with TMJ, and I found a doctor out of state. And because I was reading some of his literature and felt like my headaches, the type of headaches that I was having, related to things that he specialized in, and so I traveled out of state. And
You went to Tennessee, right?
To Tennessee,
Tennessee.
yes, to Dr. Ernest, and I was diagnosed with the splenius capitis muscle syndrome, and ended up having a radiofrequency procedure done for that.
It's a neurolysis, right?
Yes.
Okay.
And that did help with the burning sensation that I had on this area of my head. But I did not receive any relief with any of the other pain.
Okay.
And he did have me start using a splint at night.
And am I correct in remembering that Dr. Ernest said that's the best that can be done?
He did not. He felt like there wasn't anything else he could offer.
Okay. Okay. So he did his best.
Yes.
And he helped you a lot.
Yes, he did.
Okay. All right.
Then after that, I actually went to another neurologist, and that neurologist tried different medications, and it just kept on ending up with the same result. That
So
I
you're
wasn't
still
having relief.
seeking neurologists because you're still in pain?
Yes.
Except part of the pain was gone after that treatment?
Yes.
Got it. Okay.
It got to the point that the pain in my eye just kept on getting worse, and it was just continuous stabbing in my eye, and to the point that I had to wear dark sunglasses inside when I was working at school, let alone when I was outside. It was extremely difficult. So that neurologist then referred me on to another specialist that dealt with blepharospasms, and at that appointment...
Was it also a neurologist or ophthalmologist?
A neurologist.
Neurologist, okay.
And that appointment was very frustrating because I had glasses on. I had a very bad migraine when I went in there, and it had lasted for a couple of days by that point. And when the lights were turned on, then my eyes started spasming. And after we visited, then he told me that he felt like I might have Tourettes Syndrome, which was extremely frustrating to hear. He threw that out, then he said, well, I'm not seeing the personality issues that go along with that, so you'll have to come back again later for me to make a definitive diagnosis.
But that was his working diagnosis?
He was looking at that as well as mentioning atypical dystonia.
Okay.
And he started...
Atypical dystonia. Got it, okay.
And he started me on different kind of medications, and I did not have a good response to that, to the point that I was having seizures and was in the hospital. And so, of course, I saw different neurologists than when I was in the hospital, and they ruled out the dystonia that had been questioned. And through that process, they felt like I just needed to accept what I was going through, that maybe I had suppressed feelings, and that was causing my pain issues because
So
my headaches.
psychologically